Whether the head injury occurs in practice or in a game, it's important to remove the child or teen immediately if a concussion is suspected. It's up to everyone involved to recognize a concussion. Coaches, athletic trainers, parents, and teammates all play a part in helping ensure injured players get off the field.
One of the main objectives of this concussion program is to help you identify those red flags or children at risk that are still symptomatic from a concussion, and to help keep them out of play or other activities where they can sustain a second concussion.
When someone comes in after a sports injury, typically they are sent in for clearance, and they are probably doing better and recovering, so the key is the history. And very often there's a little disconnect in the appreciation of the symptoms when parents and or coaches will admit to observing some significant symptoms, such as the child was not responding to questions appropriately, seemed dazed, may or may not have been unconscious completely, but seem certainly not quite themselves. And now that they're improving, feel that everything must be okay and we can let them play again. But of course that's not our recommendation when someone's had a concussion, and that does meet the criteria for a concussion.
For reasons that we don't quite understand, multiple concussions have a exponentially accumulative effect. In other words, 1 and 1 does not make 2. 1 and 1 makes 20.
Any child who's had symptoms of a concussion, even subtle, should be pulled out of the game and not returned to play that day. That should be clear. Whether they go to the emergency department depends on how severe their symptoms are and whether or not they feel they're progressing. If the symptoms were transient and the child seems better, I think it's perfectly reasonable to let them go home with a responsible adult as long as their symptoms are improving and not getting worse. However, if the child has not returned to baseline and if the symptoms are getting worse, we should check them out.
A sideline assessment helps determine if a child or teen may show signs of a concussion and should be removed from play. The diagnosis of concussion and return to play decisions should be made only by licensed healthcare professionals.
The first thing you do is look at the patient. Oftentimes the kids will have what we call that look. They have that vacant stare, the befuddled expression. They keep looking, trying to look behind. They won't look them in the eye. They're clearly not all with it. So often you just look at a child and tell that their brain isn't functioning properly. And you start asking them questions. You can ask them the simple, where are we? Who are we playing? What quarter is it? Are we winning? That's kind of being oriented to person, place, and time. Then you can ask them some memory things. Who did we play last week? Did we win? Where was the game? Those types of things. You can ask them to do simple cognitive tasks. When the kids come off the field, you have them repeat 3 words, Honda, pencil, dinosaur, for example. And then after they've repeated them back to you, so you know they heard you, 5 minutes through your examination, and again 15 minutes, you ask them, oh, by the way, what were those 3 words I asked you to remember? If they look at you and go, what 3 words? Well, that's short-term memory loss. That's altered brain functioning, and that's considered a positive test or failed of the testing. You may have them do simple math, have them do something like 29 minus 16 plus 12. A high school athlete should be able to do that, but the concussed athlete can't. We'll do things like ask the kids to say the months of the year backwards, starting with December, or we'll give them 2, 3, and 4 numbers that they repeat backwards, such as 35, 619, 4631, and they have to repeat those to us backwards. So there is a very basic sideline assessment, which is really pretty good. A question I get asked oftentimes is how many is too many? As far as I'm concerned, 1 concussion is bad, 2 concussions is worse, but there's no magic number. There's no number that says if you surpass this number, then you need to retire from the sport. So it's not really a medical decision based on literature. It's oftentimes a family decision. We do know that when an athlete is concussed one time, there is probably a high risk of them suffering another concussion. That second concussion will probably occur or can occur with less of a blow. So it's going to take less of a force for that brain to get concussed again, and the symptoms seem to last a little bit longer every time they get another concussion. So this is all evidence that maybe the brain remembers. Maybe the brain never ever really completely recovers from a concussion. Even though their symptoms seem to be resolved, they've gone through all the proper stages of return to school and sports, and their impact tests are normal, is the brain truly back to normal, or is there always going to be some vulnerability? Second impact syndrome is a very rare, thank goodness, but catastrophic injury that occurs to the brain when the brain suffers a second blow before it's completely recovered from the first blow. For reasons that we don't understand, when that recovering or concussed brain takes another hit, you get this massive rush of blood into the brain and it can't escape. In other words, the brain is capped by a rigid skull that doesn't expand like your knee or your elbow. So if the pressure inside the skull increases, it's going to push onto the brain, and then the brain, the increased pressure has to be relieved somewhere, and the only place it's relieved is through the foramen magnum, which is the little hole at the base of the skull through which the spinal cord goes through. So if the pressure building up inside, then part of the brain starts to herniate through that little hole. It pushes on the brainstem, which decreases blood flow to the brain, as well as compresses the cranial nerves, which are the centers that tell your heart to beat and your lungs to inflate. So basically, you can have brain damage from cardiac or cardiopulmonary arrest from second impact syndrome. It's one of the conditions that I think is for the most part preventable, because it occurs when a second blow occurs while the brain is still concussed. In order to prevent that, the kids have to be aware of what the signs and symptoms of a concussion are, let somebody know, and then that somebody that they let know needs to recognize and pull that child out. So as long as it's recognized at the time of the injury and the people around them are educated in what to do and to pull that athlete out, second impact syndrome should not happen. Now, through this new research that shows that the brain still is in the process of recovering, even though symptoms have resolved, there's still evidence that a lot of these brains still have cognitive deficits. So now nobody can go back and play the same day, and they can't go back and play till they've been cleared by somebody trained in the management of concussions.
If someone's participating in a sport where they're at risk of collision and serious head injury, and they've had a history of head injuries, they're at increased risk. And we have to be thoughtful and careful about how long you're going to put your child in that situation, because we know that there's a cumulative effect from head injury, even from minor head injury. Repeated concussions is extremely bad for the brain.